humans, today we're going to talk about inflammation and why it's important in the overall healing process. Okay, so we're going to use our ankle as an example. Somebody's rolled your ankle, maybe you've rolled your ankle. The first 5 minutes, what's going to happen is vasoconstriction and coagulation. What does that mean? Vasoconstriction means all the arteries, veins, and capillaries in that region are being shut off. The flow of blood is being shut off into that region. Coagulation means when red blood cells start to stick together and they're basically trying to clog up or stop the tissue that's being torn or damaged bleeding, right? It's just trying to stop that bleeding or stop that tearing process immediately. At 5 minutes to an hour, vasodilation happens. Now this is really important. Vasodilation is when all the arteries, veins, and capillaries, they start to open up. And they open up real big and they're trying to flood the area with blood, which is the good building blocks of tissue repair. In that phase, inflammation is also happening. So this is where that redness is happening, that swelling is happening. It gets really big, it gets really hot, it gets really red. Now, it's really important that you allow the inflammation to happen, because in that inflammation process from 1 hour to about 2 days, what's happening is all of the building blocks of tissue repair are being put into the area, and all of the damaged tissue is being taken out of that area. Now, why is the 2-day mark really important? Well, the 2-day mark is important because stiffness starts to set in. Now, the stiffness is starting to set in because the body is trying to self-protect itself. It doesn't want more damage in that area. So in the example of your ankle, it doesn't want you to walk on it, right? It wants you to continue to stay in that very fixed position. And that's because it's trying to build new tissue into that region. As we can see, at day 2, new arteries and veins are starting to be laid down. At 2.5 days to 3 days, remodeling starts to happen. Now this is the most important time for tissue to be intervened at, right? This is where you start to get into therapy. Because a good therapist is going to decrease some of that stiffness, and it's going to basically be the general contractor of your ankle, and it's going to tell where the arteries, veins, and all the new tissue to be remodeled. This is also an important time where you should be trying to move into that position, right? So your ankle is it's trying to freeze up on you, and now all this tissue is remodeling. But the tissue remodeling process is basically patchwork. Think about it. They're just trying to fill in the gap and just trying to fill in those holes and making sure that the tissue is strong. But it's not actually making the tissue go into nice parallel fashion, right? It's just laying down stuff. And this is where you start to get disorganized tissue at day 2. Now, if you can get into it by moving, or you can get into it by getting a good therapist to redirect some of that tissue, the tissue will align in a more parallel fashion instead of a haphazard way, which is disorganized tissue. That disorganized tissue can cause shortening of the tissue. It could cause obviously more stiffness and more dysfunction in that joint, especially in that ankle joint. Then from 3 days to a year, your body could be remodeling. Again, if you have a good therapist or you get on top of this really quick, that remodeling phase becomes really, 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 really short. However, if you don't see a good therapist and you allow it to just kind of sit there, it can take forever. And those of you who've been in a chronic pain or chronic dysfunction of an ankle, you know that it can take this long. Inflammation generally stops at about a month. If you've had inflammation for longer than a month, then you have other issues, or you have not been taking care of this, and you should be getting into a therapist or a doctor or any type of professional that can help you decrease some of that inflammation. So, hopefully that has helped. Hopefully you've been educated a little bit more about what the process of inflammation is. This was a quick overview of what happens from when you roll your ankle to all the way down to when it starts to remodel. If you want to have any more information, if you have more questions about this, please don't hesitate to ask me. All my social media stuff should be like right here, and hopefully that helped. Move free, humans.